Hey there, science fans! Today we're tackling a topic that affects millions: rheumatoid arthritis, often called RA. Now, RA isn't just your grandma's occasional aches and pains. It's actually a chronic autoimmune disease. This means the body's own defense system, which normally fights off germs, mistakenly attacks the joints. Imagine your immune system as a security guard who suddenly thinks your own cells are intruders. That's what happens in RA. This kind of friendly fire causes inflammation, making the joints swollen, stiff, and, well, pretty painful. RA is a long-term condition. It can affect people of all ages, but it's most common in adults. And unfortunately, there's no quick fix for RA. But don't worry, science is on the case. There are ways to manage the symptoms and live a full and active life. So what causes this case of mistaken identity in our immune system? Well, scientists are still working on that puzzle. It's likely a combination of genetic predisposition, meaning it can run in families, and environmental triggers, like infections or smoking, that set things in motion. RA primarily targets the joints, those amazing hinges that let us move. The inflammation usually affects the same joints on both sides of the body. For example, if RA affects your right wrist, it's likely to affect your left wrist too. Over time, this inflammation can damage the cartilage and bone within the joint, leading to joint deformity and loss of mobility. But RA's impact goes beyond physical discomfort. It can also affect a person's energy levels, sleep, and overall well-being. It's important to remember that living with a chronic condition like RA can be challenging, both physically and emotionally. Early diagnosis of RA is crucial for effective management. So what are the warning signs? Well, RA often starts slowly, with subtle symptoms that can be easily dismissed. One of the most common early signs is morning stiffness in the joints, lasting for an hour or more. This stiffness is different from the usual getting out of bed stiffness and can make it difficult to perform daily tasks. Other common symptoms include joint pain, tenderness, and swelling, typically in the hands, wrists, and feet, as well as fatigue and a general feeling of being unwell, and sometimes even loss of appetite and weight loss. If you experience any of these symptoms for more than 2 weeks, it's essential to see a doctor, preferably a rheumatologist who specializes in diagnosing and treating arthritis. While there's no cure for RA yet, the good news is that there are effective treatments available that can help manage the disease and slow its progression. The goal of treatment is to control inflammation, relieve pain, improve joint function, and prevent further joint damage. Treatment plans are tailored to each individual's needs and may include a combination of medications, physical therapy, occupational therapy, and sometimes even surgery. Medications include disease-modifying anti-rheumatic drugs, or DMARDs, which suppress the immune system's attack on the joints, and biologics, a newer class of drugs that target specific inflammatory pathways. Physical therapy helps maintain joint flexibility, strength, and range of motion. Occupational therapy focuses on improving daily living skills and adapting to limitations caused by RA. And in some cases, surgery may be necessary to repair or replace damaged joints. Living with RA can be challenging, but it doesn't have to control your life. By adopting a proactive approach, you can manage your symptoms and live a full and meaningful life. Here are a few tips. Stay informed. Learn as much as you can about RA and your treatment options. Stay active. Regular exercise, even gentle activities like walking or swimming, can help reduce pain and stiffness and improve your overall well-being. Eat a healthy diet. A balanced diet rich in fruits, vegetables, and whole grains can help reduce inflammation and boost your energy levels. Manage stress. Stress can worsen RA symptoms, so find healthy ways to manage stress, such as meditation, yoga, or spending time in nature. Connect with others. Join a support group or connect with others living with RA. Sharing experiences and advice can provide invaluable support and encouragement. Remember, you're not alone in this journey. With the right treatment plan, a positive attitude, and a supportive network, you can live a full and active life with RA. And who knows, with ongoing research and advancements in science, a cure may be just around the corner.